and welcome back to another exercise video with SOS Elmira. My name is Gordon and I am a registered physiotherapist at our location in Elmira. And in this video, I will be looking at an exercise to try and address nerve-related symptoms in the upper extremity. So specifically, I'm talking about a neurodynamic mobility exercise, or an exercise that encourages movement and mobility of the nerve lines that run from our neck down to the tips of our fingers. So this exercise is very helpful for most individuals who would experience any numbness and tingling in the hand, and then sometimes can be helpful in addressing similar symptoms at the neck, shoulder, and elbow. So this exercise is not for everyone, so if you are experiencing these symptoms, I still highly suggest that you come in and get assessed by one of the clinicians at SOS Physiotherapy. But it is a helpful exercise and it's worth trying if you do have any symptoms in the areas that I discussed there. So this exercise is fairly straightforward and sometimes can feel like a whole lot of nothing, but it's definitely worth trying. So to start this exercise, I like to start in a waiter position. So I'm holding a tray in my hand as flat as I can, and what you're going to do from here is slowly extend the elbow, trying to straighten the arm, and you're going to continue to straighten the arm until you feel any amount of tension build up down the arm. Now it can feel like a stretch, so keep in mind that would be considered tension, and you can feel it at the shoulder, the elbow, the forearm, as well as the wrist. Once you've hit that barrier of tension, I don't want you to hold that position. I want you to come straight back to our starting position, and you're just going to repeat that movement. Gently working into that tension, gently working out of it, and not holding any position for any length of time. Now, a helpful tip to add to this would be to think about tilting your head to the same side as you do this exercise. So as I extend my arm out, I tilt my head towards that side, and then I gently come back. Now, for this exercise, I would probably repeat it somewhere in the ballpark of 10 to 15 times, and you can get to that 3 or 4 times a day. Now, it's really important if this exercise is feeling irritable or making things worse, then it's probably worth putting to the side for now, but it is worthwhile continuing if it feels comfortable and you notice a change in your numbness or tingling symptoms. But do note that you probably have to repeat this exercise multiple times and for multiple weeks to notice large increases in your movement. And one way to know that you're improving, besides the numbness and tingling symptoms changing, would be that you're able to reach farther or extend farther into the movement before that stretch or nerve tension comes on. So you were here to begin with, but over a couple weeks now you can get to here. That's super positive, and it means that that nerve line that's running from your neck down to your fingers is able to stretch and move better. So try that one out at home. If you had any of the above, it can be helpful with cervical radiculopathies. It can be helpful with carpal tunnel as well as other conditions. And as always, when in doubt, make sure to come in and get assessed by a professional if you're having trouble managing these symptoms.